Dear viewers, hope you will find. So first of all, I'm very thankful to all of you for watching my lectures on regular basis. So today I will teach you about the beta-lactam antibacterial carbapenems. This is another group of antibiotics belong to the beta-lactam antibacterial agents that is called carbapenems. So carbapenems, these are broad spectrums antibiotics which are bactericidal in nature, and they have the capability to kill the growth of microorganisms along with their spores. Come to all the clinical indications or the uses of these antibiotics, especially carbapenems. So carbapenems, they are used especially in hospital acquired infections and severely immunocompromised patients, such as those with neutropenia, decreased count of neutrophils, AIDS, and cancers. So carbapenems, they are widely used in hospital-acquired infections like a person who is immunocompromised, whose immune system is weak. So they are preferred for those patients who have neutropenia, AIDS, and cancer-like conditions. The classical example of carbapenems are imipenems and meropenems. So these are the groups, these are the drugs which belong to the carbapenems. The side effects which are reported by the different literatures, so that is seizures, it may cause gastrointestinal irritations, phlebitis, and headache. Carbapenems can be administered through intramuscular and as well as intravenous. So it means that these drugs, they are available in different dosage forms, and it can be injected to the patient in the form of IV injections, and it can be given to the patients by intramuscular route. So the classical examples are imipenem and meropenems. Come toward the basic nursing care. So what are the nursing cares? So what are the basic responsibilities of the nurse? How you will administer these drugs? So first of all, you will have to check to assess and monitor for penicillin allergy. So there are some patients which are allergic to penicillin group. So those patients who are allergic to penicillin, which may cause hypersensitivity antigen antibody reaction, so you can change the brand. The drug should be cautiously administered penicillin, as those patients who have taken penicillin without any problem in past still have a chance of subsequent reaction with further doses. I mean, you will have to ask the patient that, did you use these drugs and fast? After that, you can give that particular drug to that patient. You are also responsible to monitor the renal and liver function test and intake output, so it should be monitored, which is the basic nursing care and nursing responsibility. Another one is give the oral penicillin on empty stomach with full glass of waters, because it is sensitive to the hydrochloric acids. As we know that actually the oral penicillin on empty stomach, so they are with full glass of waters, because it is very sensitive to HCl, as I have already talked about that there are some drugs which do not maintain their stability in the acidic environment. So like oral penicillin, so then it should be taken with the full glass of water. So there may be a chances of drug instability, and this drug is very sensitive to hydrochloric acids. So if you can see, or if you observe the situations or the condition of your stomach, so our stomach, there is actually acidic environment there, so there are some drugs which are not not maintain their stability and the acidic environment, so then you can change the brands or alternate route can be adopted. While administering penicillins, IV site should be changed for the 8 hours to minimize the blood vessel irritations. Sometimes you know that whenever you are going to inject the penicillins G in the form of injections, so penicillins and especially an IV route, so there may be chances of thrombophlebitis, inflammation of the blood vessels. So you will have to change the site of injections within 24 hours to minimize the blood vessel irritations. More words I would like to recommend. So give intramuscular injection into the large muscle and rotate the site as it causes pain. As we know, that this is one of the disadvantages of intravenous injections whenever you are going to inject a syringe. So there may be chance of pain sensation, hypersensitivity. So then you can change the site of injection and look for, then the nurse is also responsible to look for and report the sign of resistance. The nurse should monitor the patient receiving the imipenem for the seizure, especially elderly and a patient with renal impairments. For example, a patient who is suffering or inflicted by the seizures, or the patients having some renal impairment, so in that case then you should administer the drug with precautions. If nausea appeared, let's suppose if nausea appeared with imipenem administrations, so then you can slow IV rate, then you can inject the drug by intravenous route, but slowly. I mean that let's suppose whenever you are going to inject a syringe, especially in the muscles or or in the veins, so at that time it is very important to release that drug slowly and gradually, so that will minimizes the chances of side effects and adverse drug reactions. Sulfonamides, so this is another drug which is called broad spectrum antibiotic, which is also bacteriostatic in nature. So sulfonamides, so it will the group members, especially the drugs which belong to this group, the classical example, they are sulfadiazine, sulfamethezole and sulfapyridines. Mechanism of action or mode of action of sulfonamides, that how the drug can reach its target site, so it can prevent the synthesis of folic acid, which is required for the synthesis of bacterial DNA, which I have already discussed in my previous classes, that there are some drugs which are also called DNA synthesis inhibitors. But the exact mechanisms of the sulfonamide, so it can stop, it can prevent the production, the synthesis of folic acids, which is required for the synthesis of bacterial DNA. So you will have to stop the growth of bacterial DNA in order to block, in order to max the productions, the synthesis of folic acids. The clinical indication of the uses of sulfonamides, so that is in the treatment of pneumonia, dysentery and meningitis. The side effects which are reported by the literature, so if sulfonamide they are used, so after administration of sulfonamide, so these are the different side effects which are reported here. So it may be, it may cause nausea, vomiting and epigastric pain, as well as CRYSTALLURIA. CRYSTALLURIA is the conditions if the urine is highly acidic, the sulfonamides may precipitate and causing CRYSTALLURIA. Hypersensitivity may be occurs with the use of these agents. Hemolysis, rupturing of red blood cell and white blood cells. Okay, come to our drug interactions. You know about drug interaction that whenever, for example, if we are going to administer two drugs simultaneously, so one drug will increase, decrease or cancel the effect of one another. So these are the interactions. There are some major interaction and some minor interaction. So especially on interactions, you can say that sulfonamide, it can increase or enhance the effect of warfarin and phenytoins. I mean that if sulfonamides can be used with a combination with phenytoins and warfarin, so it will increase the effect, the effect of warfarins. So some interaction, they are minor, while some interaction, they are major. The routes of administration, that is per orals or topical, that is, it means that these drugs, they are available, it can be given to the patient in per oral, topical, as well as in the form of parenteral preparation, intramuscular, and in the form of IV injections. What are the basic nursing care which is required for sulfonamides? So in the same case which I have already discussed, so you will have to assess the patients for allergy with sulfur drugs. So some people or some patients, they are very sensitive to the sulfur group. So you should assess the patient. You should assess the patients with allergy with this sulfur drug. Then you can change, then you can use another brand, another drugs in order to reduce the hypersensitivity and allergic reactions. The second main goal and main responsibility of the nurse is you will have to monitor, strict the intake output. Changes the night indicate effect on the renal function, and visually you can examine the urine for the crystals. If the crystals, so they are appear in the urine, so you should take much care. You should also monitor the CBC, complete blood count, periodically, and after that you should instruct and reinforce adequate hydrations. You should check all the parameters which are mandatory for the, especially for the nurse. Another thing is you can instruct the client to avoid the foods such as those containing vitamin C that produce acidic urines. As well as the nurse is responsible to administer these drugs on empty stomach with full glass of water. However, if a gastrointestinal, if GIT irritation occurs, so it can be administered with food. Another drug is that is tetracycline. So tetracycline, it belongs to another group that is called broad spectrum as well as bacteriostatics. As we know that how we can differentiate between bacteriostatic and broad spectrums. So the classical examples of the tetracyclines are acromycin and doxycycline. The mechanism of action or mode of action of tetracycline, so it can inhibit the bacterial protein synthesis by combining with the ribosome, thus reduce the microbial growth. What are the main objectives and main targets in order to target that particular area which become the cause of the disease? So you will have to target that microorganisms like this bacteria. So tetracycline is also called bacterial protein synthesis inhibitor. Why that is called protein synthesis inhibitor? So in order to stop the growth of protein by that is combined with the ribosome, and ribosome is responsible for the protein synthesis. So you will have to inhibit the growth of the proteins which are found inside the body of that particular microorganism. So you will have to stop the growth of that microorganism, that proteins, with the help of these agents, with the help of these antimicrobial agents. Thus it reduces the microbial growth. Okay, see, another one is clinical indication. This drug is used in the treatment of uncomplicated urethral and rectal infections. So, for example, whenever there is infection in the rectums and let's suppose uncomplicated, so you can use it. This drug can be also used in pelvic inflammatory disease and as well as sexually transmitted disease. These drugs can be recommended. These are the side effects which are reported. So tetracycline may cause GIT upsets, phototoxicity. So this is the major side effect which causes red rash upon sun exposure, liver damage maker, and as well as the you can say the kidney damage, vestibular toxicity, ataxia, vertigo, dizziness, and discoloration of teeth. As well as it may retard or stop the fetal skeletal development if taken during pregnancy. Okay, one thing should be kept in mind. The tetracycline, this is contraindicated in pregnancy, so it cannot be used. You know, if this drug is used, if this drug can be used during pregnancy, so there may be, there is 100% chances of teratogenetic effect. So teratogenicity, there may be chance of developmental abnormalities. So the baby will become abnormal and many and more complications regarding pregnancy. So this drug is strictly prohibited. You can use the alternate brand. Precautions mean this drug can bind with the calcium and magnesium as well as aluminum ions to form insoluble complexes, and thus dairy products, antacid and iron salts reduce the absorption of tetracycline. You know, so let's suppose if tetracyclines tetracycline can bind with the calcium, magnesium and aluminum ions, so it will form the insoluble complexes. So after insoluble complexes, the absorption of the drug will decreases, and thus the dairy effects, antacids and iron salts reduce the absorption of tetracycline. The routes of administration, they are peroral, intramuscular and intravenous. Okay, so come toward the contraindication. So the tetracycline, they are contraindicated. It cannot be used in pregnancy as well as in lactation, and especially the children which are under 8 years. So it cannot be recommended. Okay, another one is nursing care. So regarding nursing care, these antibiotics can be administered with food. So especially you should know the value, the precautionary measurements. So the nurse is responsible to administer this drug with food while giving IM injection, so you can change and rotate the sites. The nurse is also responsible to avoid taking with dairy foods, antacids and iron preparations. And the nurse is also responsible to provide adequate hydrations, and you should advise for protective clothing and sunscreen to prevent from phototoxicity. You should also monitor the liver and renal functions. Test, you should check the liver function test and RFT and LFT liver function test. You should monitor all these parameters. After that you can administer that drug. So take complete history for pregnancy and lactation. This is also very mandatory. And another one is you should also assess for the vestibular toxicity. Okay, so another group is fluoroquinolones. So inshallah my next lecture will be on fluoroquinolones or quinolones. So this was all about today lecture, inshallah. So if you have any questions, so I am always available for your services. Thank you so much, dear viewers, for watching my lectures. Wish you all the best. Thank you.